So, how do you live fully with an incurable disease? It's a pretty intense paradox when you stop and think about it, right? Usually, when we hear the word incurable, we automatically think it's the end of the road, just a waiting game. But what if it wasn't? What if getting a terminal diagnosis was actually the starting line for the absolute most disciplined, vibrant, and intentional chapter of your life? Today, we're unpacking a deeply personal, remarkably clinical, and just incredibly inspiring case study of a patient who did exactly that. 10 10 whole years. That is how long this individual has been locked in a grueling battle with multiple myeloma. If you're not familiar with it, multiple myeloma is a brutal blood cancer that starts right in the bone marrow. Medically speaking, it's considered totally incurable. It's normally just a disease of management, of trying to buy a little more time. But as we'll see in today's explainer, this patient hasn't just bought time over the last decade, he has fundamentally, completely redefined what it actually means to heal. All right, let's dive right into this. Welcome to our explainer on the infinite value of holistic health. We're going to look at this incredible 10-year real-life story to figure out exactly how this patient has defied the odds. We're going to break his survival down into a really clear, replicable philosophy of holistic health, which basically combines advanced modern medicine with this profound mental and spiritual discipline. Here's a quick look at our roadmap for today. We'll start with the 10-year cancer battle, then move into defining holistic health, modern medicine and maintenance, the power of physical discipline, faith, mind, and community, and we'll wrap up with winning the small battles. Section 1, the 10-year cancer battle. Let's look at a decade of serious resilience. To really appreciate this guy's philosophy, we have to understand the sheer scale of his medical journey. 10 years ago, the whole thing started with a late-stage diagnosis that was so severe it actually caused a spinal fracture. We'll definitely talk more about that physical trauma in just a bit. But look at the trajectory that came after that. 9 solid years of remission. I mean, that is a massive clinical victory. Then, last year, the inevitable happened with this type of cancer, a relapse, which meant 6 grueling months of chemo. But here is the craziest part. Today, after a recent bone marrow aspiration, his oncologist declared him completely cancer-free, complete remission. Reaching that state again after a relapse with an incurable blood cancer is, honestly, nothing short of miraculous. Moving on to Section 2, defining holistic health, balancing body, mind, and spirit. So, the big question, how did he do it? Well, he defines holistic health in a very specific way. He argues that physical health, all on its own, eating right, sleeping enough, exercising, it's just not enough for true healing. To really heal, you have to combine those physical maintenance tasks with a deep mental and spiritual well-being. That combo right there is what he calls creating a complete value of life. It's all about treating the entire human being, not just attacking the cancer cell. This essentially translates into a multi-pronged, 4-pillared approach. We're talking an advanced medical strategy, rigorous physical discipline, a really strong psycho-spiritual foundation, and a deep, deep connection to community. It's like a structurally sound building. If any single one of these pillars falls, the entire foundation of his survival is compromised. Section 3, modern medicine and maintenance. Let's talk about strategic clinical care. Let's dig into that first pillar. Now, this patient isn't rejecting science. Actually, it's the total opposite. He leans into it with this incredible strategic precision. Think of his medical approach kind of like a long war military campaign. Step 1, intelligence gathering. That means routine monitoring via bone marrow aspirations to make sure his body is producing healthy blood. Step 2 is suppressing the enemy, which involves monthly maintenance chemotherapy. He absolutely knows it won't cure him, but it keeps those residual cancer cells pinned down. But Step 3 is where his strategic brilliance really shines. He and his doctors already have backup treatment plans prepared for when, not if, mind you, but when the current therapy fails. Being that forward-thinking totally strips the panic right out of the entire process. The really crucial takeaway here is his super rational approach to conventional medicine. He operates on a very simple principle. You overcome physical discomfort by taking your medicine and getting your injections. He doesn't rely on sheer willpower to magically manage his symptoms, and he definitely doesn't chase unproven alternative remedies just to avoid the nasty side effects of standard care. He uses the tools of modern medicine exactly the way they were intended, to buy the time and the physical comfort he needs to do all the rest of the hard work. Section 4, the power of physical discipline. It's time to reclaim the body. And that brings us to the rest of the hard work we just mentioned, the patient's pure grit and physical resilience.
You have to hear this dramatic contrast. 10 years ago, the cancer literally crushed his 11th vertebra, literally crushed it. It had to be surgically stabilized with steel rods and screws. Because of that catastrophic structural damage, if he just sits back and does nothing, he can only stand for maybe 3 to 4 hours before his back completely gives out and he hunches over. That is a massive physical limitation. But look at his proactive solution. He absolutely refuses to let that define him. Instead, he does rigorous daily back and core muscle exercises to physically compensate for that damaged bone. Every single day, he actively fights to reclaim control of his own body. He even lugs his exercise equipment to support groups so he can teach other patients how to do it. It's just wild.
Section 5, Faith, Mind, and Community. Let's look at the emotional core of all this.
So we've covered the body and the medicine, right? But surviving a 10-year fight requires an absolutely unbreakable mind. And that brings us to one of the most powerful insights from this whole case study. He says, I pay attention to my condition, but I am not afraid. Notice that incredibly healthy psychological line he draws there. He's vigilant. He gets his scans, he takes his chemo, but he is not letting fear consume him. He actually views paying attention to his disease as a way to gather knowledge so he can help other people down the road. And as for the lack of fear, that comes straight from his deep Christian faith. He trusts that he's always protected, no matter what the medical outcome ends up being. He takes that mindset a step further by basically weaponizing gratitude. He talks about how thanksgiving and trust complement each other. And for him, this isn't some fluffy abstract idea. It's a literal, everyday tool he uses to build mental armor. The cool part is, science entirely backs this up. Practicing gratitude is proven to lower cortisol and cut down stress. He talks about waking up, seeing the morning sunlight, seeing his sleeping wife right beside him, and just feeling this immediate rush of gratitude for getting another day. By practicing that constantly, his trust and peace of mind just naturally increase, and it literally pushes the anxiety of having cancer right out the door. All of this builds into a structured framework that he calls his upward and downward connections. Upwardly, he's connecting spiritually, praying, reading scripture, singing hymns. He says this is what brings him real comfort and joy when he's going through intense physical pain. Downwardly, he connects with his community. We're talking church groups, long-term friendships, acts of service. It creates a safe space for shared tears, shared laughter, and just solid support. Think about it. This is a highly intentional, built-in system to completely avoid that crushing isolation that so often comes with chronic illness. Section 6, Winning the Small Battles, Turning Big Ideas into Actionable Daily Habits. So how do you actually take these massive themes, medicine, faith, physical discipline, and turn them into stuff you can do every day? You do it exactly like this. He says, I only ask for 1 or 2 small victories every day, accumulating small victories into a great victory. Then this life will not be in vain. Honestly, this is the magic, right here. This is the ultimate secret to enduring a decade-long crisis. You don't wake up trying to cure an incurable cancer all at once. You don't try to instantly fix a crushed spine. You just focus purely on winning the day you are in. A small victory might just be getting through a rough chemo session, or finishing your back exercises, or even just sharing a really good laugh with a friend. Stack those tiny victories up, day after day, for 10 years, and you end up with a beautifully full, deeply meaningful life. And that right there is the core lesson of this explainer. This is so much more than just a story about a man surviving multiple myeloma. It is an absolute blueprint for every single one of us on how to live with intention. Whether you are facing a major health crisis yourself or you're just trying to navigate the crazy stress of daily life, the framework is exactly the same. Combine physical discipline with a strong mental foundation, lean hard on your community, and just focus on the step directly in front of you. So I want to leave you with this question to chew on today. What small victory are you going to claim today to build your own holistic health? Take that step, win that small battle, and whatever you do, keep moving forward.